many women shy away from, but now's the time to get serious and get help if necessary. Here with more on menopause and everything that has to go with it is Dr. Rhett of the Rhett Center. How are you?
I'm fine. How are you?
I'm doing well, and it's been great talking to you, Doc. But give me a couple of maybe the symptoms, because I'm sure there's plenty of women out there right now that say, I think it might be me, but I'm not really sure. So some of the symptoms that you might be dealing with right before menopause sets in.
Well, menopause strikes every woman differently. Only 10% of women get up to their final menstrual period and then just stop menses and have no symptoms. Everybody else sort of stumbles in. The average age of menopause is 51 and a half, and you can have symptoms from your early 40s of irregular menses, of hot flashes, night sweats. They come and go, and then they're gone for 3 months, and then they're back again. As you get closer to the age of menopause, 51 and a half, the symptoms can increase. They can have irregular periods, long periods, short periods, periods twice a month. And so all of that just needs some evaluation from somebody who cares to take the time to figure it out.
And when you talk about that evaluation, women can come to your office and get that evaluation. Possibly, what would they need to do, or what can they expect if they come in?
Well, they ought to have a complete history and physical, and somebody that has the time to listen to their problem. Every woman is different, and every woman's symptoms are different, and so you have to just take the time to do that.
And speaking of taking the time, you've actually stopped doing obstetrics, so now you have plenty of time to help out.
Right, and I think that that's one of the great advantages of one of the things I really like about what I'm doing now, is that I have the time to sit and talk about a problem, discuss that problem with each individual woman, and figure out the best method of helping her through whatever's bothering her. Okay. And that's not just with menopause, but that's other difficulties that women experience from age 13 on.
That's very true. And Dr. Rhett, speaking of all types of women and all women and women of all ages, you actually have an amazing procedure that you offer in your office. And it's with this contraception that actually has no incision whatsoever. And I think we're looking at the animation right now.
Right. This animation shows something called an Essure tubal ligation, and what happens is we can go up through the cervix with a scope, and put this small insert into each tube, and over about a 3-month period of time, the tube, you can see it grows around that insert, and the tube becomes permanently blocked.
And that is permanent contraception for those women that think that that might be something that they're ready for.
You have to be really sure that you don't want to have
irreversible.
It's irreversible.
Okay.
And so you should be ready to. You should say, my family is finished, I'm sure, and I want the best method of sterilization that I can find.
And you've been accredited at your office, so you're ready to really help out.
We went through a fairly extensive process to make sure that the operating room suite that we have is accredited. And so we can use anesthesia in our accredited operating room. And if without accreditation, you have to do it without anesthesia.
Right. And want to point out, for those women that don't want to be put under, you don't have to be for this procedure. And you're saying some women are tough enough, they can go back to work the very same day.
We've done a number of these procedures under just local anesthesia, and those patients are in the office for less than an hour, and then they're back at work.
Wonderful.
Now, I have to emphasize that it takes 3 months for the permanent contraception to take effect.
Okay.
And then we have to do sort of a test that says my tubes are blocked.
Okay.
And but it is the most effective method of permanent contraception other than hysterectomy.
All right. Well, for those women out there right now, Dr. Rhett, that want to find you, want to know where they can find you at, you're over on Long Point Road. Where exactly at?
Just across from Seacoast Church on Long Point Road, and our telephone number is 375-2210.
Wonderful. And RhettWomenCenter.com is the website. We'll have all that information on our website as well, abcnews4.com. Dr. Rhett, so great to see you, and thank you so much for being here.
Thank you so much for having me.
We really do appreciate it.
Okay.
All right. Well, when we